So Jennifer was telling me that I think you guys heard me last around somewhere around the stats. I won't go over them too much. Um, I will share these slides so you can have this information if you're curious. Um, but I'll quickly just go over GARD. GARD stands for the Georgia Alzheimer's and Related Dementias. That's three things. It's the state plan, it's the advisory council, and the collaborative. Um, a little bit about GARD. In 2010, Congress, the National Congress in DC, passed the National Alzheimer's Project Act, which created the National Dementia Plan. And then states started following suit. Georgia included. The GARD plan was signed by Governor Deal in 2014, and that established the GARD State Plan Task Force. So they were really responsible for creating that first document that we were going to be working on. Work groups were established around areas or sections of the plan that I'll mention in just a moment. In 2016, my predecessor, the GARD coordinator, was hired within the Division of Aging Services. And in 2018, the Senate reestablished that task force as the advisory council. Advisory councils are members designated by law, like our Commissioner Crittenden, or appointed by the governor, like Lynn Ross, a woman who's living with mild cognitive impairment. In 2020, the GARD plan was updated. And this is something we wanted to make sure that this wasn't just a plan that was stuck in 2016 or 2014 when it was originally made. We wanted to make sure that it remained responsive to the needs of Georgians. So we took the original content and we looked at it and we looked at what needs to be put on the shelf for now. What should we really be prioritizing? Who are the key partners who can help us get there? And that's all laid out with strategies and goals in a really, really clear format that I love the new plan. If you're interested in seeing it, you can go to the DAS website and find it updated there. So the 6 work groups that I mentioned are the workforce development, and I'll go ahead and say these are not very vague descriptions. They are very clear and spot on what they do. Workforce development is making sure that we have a workforce that is prepared to address the needs of those who are living with dementia. Service delivery is making sure that we're able to connect people with that workforce and those services that they need. Outreach and partnerships is what I call the marketing arm of GARD. It's not just that, but it's in part that. They're the ones who do outreach when it's needed and make partnerships to bring in those experts as we need them. Research and data collection. They do research and they collect data. And what a little more of what that means is working pretty closely with the Department of Public Health on some of the data around dementia, looking at where are we, what are our needs, how are we doing, how can we do it better. Public safety looks at how we can make sure we're keeping this population safe, whether that be in all the way from falls prevention to law enforcement training. The policy work group looks to see what policies should be changed and makes those recommendations. And the collaborative is the one who make up the work groups. And the collaborative is a group of really fantastic volunteers who are experts and stakeholders from academia, government, nonprofit healthcare, and those who are living with dementia and their caregivers. I want to point out government is on here. We have plenty of people from various agencies, including a lot within DAS, who work with GARD. If you're interested in doing that, I encourage you to. This could be volunteering in your own time, of course, but it also could be your job dovetails with our mission. So much of the collaborative, they're working with us. The chair of the Workforce Development Committee is the head of the Gerontology Institute over at Georgia State. Her work directly dovetails with ours, and so she is a fantastic partner. When we're doing well, she's doing well, and vice versa. If that's something that you're interested in, if you look at the plan and you're thinking this is something that matches my workflow, I hope that you'll reach out to me. A couple of things that came from the Workforce Development Committee. The Workforce Development Dementia Competency Guide came out a couple of years ago, and it's just a quick guide for people to learn a couple of tips and tricks to become more person-centered when they're giving care to people. The Outreach and Partnership Work Group created a Brain Strong flyer, which we're updating right now, but this is something that is really just a general health tool. How can you keep your brain strong? And easy tips on the front: ask for a memory screening, take control of chronic diseases, get healthy, be active, learn new things, connect with family and your community. And the back expands on those and gives tips and tricks on how to do those things more specifically. One of the great things to come out of GARD is the Georgia Memory Net. And if you have questions about this, I'm happy to connect you to my colleague, Courtney Levy. She's the GMN coordinator. But a quick briefing on Georgia Memory Net is that it is wonderful wraparound patient care for those who are living with dementia. It starts with a primary care provider. They do really great outreach to the public, asking them to go annual, get their annual wellness visit through Medicare. They're also doing outreach to primary care providers to say, make sure you're doing a memory screening when you go there. If someone is presenting with cognitive issues, they may be directed to a memory assessment clinic or a MAC, where they can be treated by a dementia-trained neurologist over one or two meet appointments and get a diagnosis. And that early and accurate diagnosis is super important. I'm not sure where you heard me cut off a while ago, but one of the stats I mentioned is that about half of the people who have a form of dementia don't know it, and about 337,000 Georgians have self-reported subjective cognitive decline. That means they said, I know something's wrong, but I don't have a diagnosis. That might be dementia and it might not. And that's why that diagnosis is so important, because we know that there are interventions. If it's dementia, we want to make sure that we're getting the proper care for them. If it's not dementia, it could be something that's completely treatable. If it is dementia, that the person receives a personalized care plan and is then referred to their local AAA and Alzheimer's Association for resources that they can have as they continue on their path. So GMN is a really wonderful resource we have here in Georgia. Again, if you have questions about GMN, let me know and I'll connect you with Courtney. Another great program we have with GARD is Dementia Friends. It has the 5 key messages in that quiz I gave you earlier. I won't belabor this, but it's a great informational tool for the community, and every AAA has what we call a Dementia Friends champion, someone who can offer a session. It's a basic 1-hour session. It's fun and interactive. If you'd like to become a dementia friend, the Department of Human Services, OLEO, our Outreach of Legislative Affairs office, they actually do a monthly Dementia Friends session online. We had one this morning. If you're curious about that, let Jennifer know. We'll get you connected, or you can probably just Google Georgia DHS Eventbrite. That's what I do sometimes, and it'll take you right there where you can register for one of those. And current and future projects, again, I'm rushing through this because I'm so sorry you missed most of it last time. Current and future projects, the APA trainings, the Workforce Development Committee has made a wonderful contact with the American Psychiatric Association. We talked about, I talked about earlier how dementia is not just memory problems, it could be a number of things. And we want to make sure that if you go to a psychiatrist and you're like, man, something's wrong, if they're thinking, yeah, it's not matching anything I know of, but we know that they're having something, that they're also keeping dementia in mind. So this is going to be a training where they're learning about some of the dementia symptoms that aren't memory, which is kind of what we think about first. Making sure that they're able to go, oh, it might be dementia. Let me make sure you're connected to the right person. Again, going right back to that early and accurate diagnosis. The Outreach and Partnership Work Group is working on content for a website redesign. The DAS website has a lot of great information on it, and I'm working to make sure that it is user-friendly as possible. Again, the GARD work group is. I am their facilitator, and they are the wonderful workhorses. And the Dementia Friendly Strategy Group, which is underneath the Outreach and Partnership Work Group, they're working on a toolkit for communities who want to become more dementia friendly. And the Public Safety Work Group is in the very early stages of talking about making a kit for somebody who might be living with dementia who has to go to an emergency shelter, something we know that can be scary and bewildering for anyone, but particularly for someone who needs that constance. And this is something for their caregivers and perhaps them to make the transition there a little bit easier. If you have questions or you want to get involved with GARD, I encourage you to reach out to me. They're always looking for people. It might be that your mission dovetails nicely with some of these. I would encourage you to reach out. We can help you do your job a little bit better, and y'all can help us implement the state plan. And ultimately, we're serving Georgians living with dementia, and that's the most important part of this. That was my super fast presentation. Does anyone have questions?
And we will send out the slides so
Yes,
that you'll have
yes.
those to reference. Anybody want to raise your hand or unmute?
Eileen, what work group do you see growing the most with the updated state plan?
That's interesting that you say that. One thing in my longer version, I didn't say it here. We are working, I think all of them are kind of growing right now because of a huge grant that GARD worked with the Department of Public Health last year to get, a bold grant through the CDC, building our largest dementia. And so all of the GARD work groups are having smaller projects that relate to that. And so I think all of them, maybe the most active though right now, are outreach and partnerships, especially with that dementia friendly strategy group really getting excited and involved, and the workforce development. And I take no credit for the workforce development. It is truly because they have a wonderful chair in Jen Kraft Morgan.
The coolest one is public safety, though.
And that would be where Jennifer Hogan is, and she's amazing.
We are kicking off. We are working on the dementia and disaster preparedness in our work group, and we would love to have some more folks at the table who have that different perspectives on that.